Prof, good morning, and thank you very much for your time. Just to kick off our discussion very quickly, this research, where was it carried out, and how many healthcare professionals did you study?
Thank you for the opportunity. This study was conducted in an academic psychiatric hospital in Gauteng. It was a qualitative contextual study, and male and female psychiatric nurses participated. Because it was a qualitative study, data was completed after 8 interviews.
Okay, and you found that these psychiatric nurses, in fact, run a high risk of being exposed to aggression, both from patients and their colleagues.
That's right. In this specific study, the focus was on aggression from colleagues. They verbalized that they didn't experience physical violence or aggression, but that they experience verbal and non-verbal aggression. Verbal aggression as being called names, being, made jokes about, and non-verbal by being ignored and isolated.
What are the causes of such non-verbal aggression? Why would they be experiencing it?
I'm not sure. We didn't look at the causes, but just the experience thereof. It may be the stressful environment, I could think. You know, it's quite stressful to be a psychiatric nurse and look after people with challenges in their mental health.
Now, is it the nature of the jobs they're doing, because this is psychiatric treatment, or could there be other factors like social factors, cultural factors?
Well, as you know, we've been put as a number first toxic country in the world, and they quoted a lot of stress factors, as you say, social, physical, and otherwise. So maybe that's also a contributing factor, as you are saying.
Are there other places in the healthcare space that you would find aggression prevalent in? I mean, we've reported here on Morning News today about doctors coming under attack in different hospitals from patients at times. But in this study, could you say there will be other areas where there's a prevalence?
Well, based on other studies I know about, we used as a literature control, you find this also in, as you said, general hospitals. All health professionals are exposed to aggression. You find it at clinics and quite all over the healthcare system.
Now, particularly in this study with psychiatric healthcare professionals, what would the impact be on them as they're doing their work? What could be the effect be on them in long term, the exposure to such non-verbal aggression?
You know, the non-verbal and verbal aggression causes more emotional turmoil and psychological challenges than physical violence and aggression. So that would mean that they would get preoccupied with themselves and the experience and their feeling of being rejected and isolated, and they would not be able to fully focus with empathy on the patients they are caring for.
So affects how...
And this will also go with them to their homes and to their families.
It affects how they then do their work and how they relate at home and outside the hospital. Thank you very much. That's UJ Psychiatric Nursing Lecturer, Professor Marie Pochenpoel, talking to us about the research that has been done among psychiatric nurses.